Assalamu alaikum. My name is MAZIN SAADI. This is my graduation project about guided biofilm therapy to explore the importance of a new approach and the use of a new system which help in periodontal disease treatment. Guided biofilm therapy, it is a new method for professional prevention, is emerging in various disciplines. It is innovative prophylaxis and it is faster, cheaper, and less aggressive than traditional methods. Now, we need to explain biofilm. Biofilm, it is a mass of bacteria that grows on surfaces within the mouth. It is a sticky, colorless deposits at first, but when it forms calculus, it is often brown or pale yellow. It is commonly found between teeth, in the front, behind, and chewing surfaces, along the gum line or below the gum line. It is a major cause of periodontitis, implantitis, mucositis, caries, and gingivitis. Development of biofilm is a multi-stage and very complicated process. The first stage is adhesion. Initial phase adherence to soiled surface, tooth enamel, and other sides such as tooth root and dental implant, followed by formation. An irreversible connection of bacteria constituting the start of matrix formation, and then accumulation. As a result of previous steps, this leads to increased dental plaque complexity. Cell division of new bacteria also allows the bacterial population to increase. And then maturation stage. In this stage, microbial diversity continue to increase while rates of cell division decrease. Thick layer of dental plaque biofilm has formed. The last stage is dispersion. Enzymes that degrade the biofilm allow some bacteria to detach themselves from biofilm to spread and colonize new surfaces in the oral cavity. When dental plaque mineralization occurs, then we call it dental calculus. Dental calculus is a form of calcification process in the oral cavity environment where calcium and phosphorus ions originating from saliva play a major role. This calculus is simple through interaction with the dental plaque. There is two types of dental calculus based on location, supra and subgingival calculus. There are many methods to remove these calcifications, starting with the hand instrument or scaling by using ultrasonic scaler, and use the brushes or rubber caps and paste and polishing to remove dental plaque. These methods are called routine scaling and polishing. There are many difficult areas to reach by routine scaling and polishing, such as brackets of orthodontic appliance, dental implant surfaces, furcation area, and interdental spaces. So, this procedure don't completely remove deposits from all surfaces. This problem is one of many problems that are resolved by GBT. What is GBT? GBT is a prophylactic treatment approach, biofilm management, complete cleaning of teeth, preserved tooth, and tissue. The protocol of GBT includes 8 steps. I will come to it later. To perform guided biofilm therapy under optimum condition, the EMS company produced a new unit. This unit is EMS dental device. This device is airflow that considered as game changer. Now we have a question. Why considered as game changer? Dental biofilm is the main etiological factor for caries, periodontal and implant infections. Periodontitis can increase the risk of systemic diseases such as cardiovascular and respiratory diseases, arthritis, and diabetes. Regular oral hygiene combined with professional measures keeps biofilm under control for a better oral and systemic health. The EMS dental device consists of many parts. I will explain these parts from left to right. Airflow application, Biofilm application, P-zone application, plus and classic powder chambers, wireless boost beetle, P-zone bottle, night cleaner bottle, and bottles of powders. The guided biofilm therapy include 8 steps: assess, disclose, motivate, airflow, bioflow, P-zone, check, and recall. The first step is assess. We should prepare the patient and then probe and screen every clinical case: healthy teeth, caries, gingivitis, periodontitis, and healthy implants, mucositis, pre-implantitis. The second step of GBT is disclose. To make biofilm visible, highlight to patients the disclosed biofilm and their problematic areas with the EMS biofilm discloser. After biofilm disclose, the color will guide biofilm removal. Once biofilm is removed, calculus is easier to detect. The third step is motivate. We should raise awareness and education by emphasize on the prevention and instruct your patients about oral hygiene. After these steps, we apply the airflow. Remove biofilm, stains, and early calculus. Use airflow for natural teeth, restoration, and implants. Remove biofilm supra and subgingivally up to 4 mm using erythritol powder. Remove remaining stain on enamel using a classic comfort powder. Also remove biofilm from gingiva, tongue, and palate. There are many types of powders used in airflow: erythritol powder, glycine powder, sodium bicarbonate, calcium sodium phosphosilicate, and aluminum thyroxide. The erythritol powder is the best because it has a smaller particle size and less abrasiveness. Now we have a comparison between erythritol and sodium bicarbonate powders based on indications. The erythritol is indicated on tooth, gingiva, restorations, implants, and orthodontic appliance, while sodium bicarbonate is not indicated. Therefore, the GBT recommendation for erythritol is 90%, while for sodium bicarbonate is only 10%. Here we have a comparison of effects on soft tissue between erythritol, P-zone, and the curette. There is no erosion effect by erythritol and it is non-invasive. The application of P-zone PS, there is a minimal erosion and minimal invasiveness, while when applied to curette, the damaging to soft tissue is high. There is a high damage on keratin layer and epithelial cell layer, so it has high abrasiveness. Based on enamel roughness, we have a comparison between the effect of normal polishing with the paste and air polishing with erythritol. The finding in scanning electronic microscopic, the erythritol has no change in enamel surface roughness. Therefore, erythritol proved to be a least abrasive air polishing powder to enamel. This analytic figure shows effect of different air polishing powders on dental implant surfaces. If we focus carefully, we found the erythritol air powder has minimal change and less roughness than other air polishing powders. Here we have the effect of 5-second air polishing on a glass ionomer. The erythritol has no change effect and doesn't rough the surface, unlike other powders. The fifth step of GBT is bioflow. We have to remove biofilm in more than 4 mm to 9 millimeters by using erythritol powder on natural teeth in deep pocket and furcation and implants. The PerioFlow is achieved by EMS PerioFlow. It is one of components of EMS dental device. The EMS PerioFlow has gingival tip or nozzle. It is extra slim and extra flexible. This tip has pressure released grooves and 3 horizontal air and powder outlets. PerioFlow is very important because biofilm in periodontal pocket destroys soft tissue and bone. During maintenance in deep pocket, PerioFlow offers unique advantage. The tip is extra slim and extra flexible. The nozzle slips easily into the pocket and gently aligned with the root anatomy. Biofilm is gently removed from the entire pocket. Hard and soft tissues are preserved. On implant surface, PerioFlow is efficient and safe. Biofilm is removed in only 5 seconds per site. After we finished from airflow and PerioFlow, we need to applicate B-zone. B-zone is the 6th step of GPT. In this step, we need to remove remaining calculus by using specially designed instruments. These instruments include PS. PS is a universal instrument for supra and subgingival calculus scaling up to 10 millimeters. It has best interproximal axis. It is suitable in 95% in all cases. PSL and PSR for medial and distal scaling up to 8 millimeters. And then PI, it is a plastic covered instrument using for implant cleaning. It is maintain the integrity of implants and restoration surfaces. It's scaling up to 3 millimeters. After we finished from B-zone, we need to check. We should make our patient smile and do a final check for remaining biofilm, ensure calculus is fully removed, accurately diagnose caries, and protect with fluoride. Now we reach to the last step of this procedure, which is the recall visit. Healthy patient mean happy patient. We make a schedule recall frequency according to risk assessment and ask your patient if he or she like treatment. Thank you for listening. I'm ready for any question.